It's pretty normal to have some nerves before childbirth, right? But what happens when that anxiety is more than just nerves? What if it's an all-consuming fear? Well, that's what we're diving into today, something called tokophobia, a profound fear of childbirth that goes way beyond the typical jitters. I mean, of course, it's natural to be a little anxious about something as huge as childbirth. But for some people, it's not just anxiety. It's a really deep, powerful fear that can shape their entire life. So where do you draw the line between just having the usual pre-baby worries and a genuine phobia? That's exactly what we're here to figure out. And that brings us to the actual clinical term for this, tokophobia. It's defined as an intense and sometimes irrational fear of pregnancy or childbirth. So don't think of it as just being worried. This is a recognized phobia, kind of like being terrified of heights or spiders. But obviously, this one comes with a whole lot of really personal, really complex stuff. Okay, so who does this actually affect? You might think this is something that only affects first-time parents, but that's not the whole story. The reality is way more nuanced than that. Yeah, so there are actually two main types of tokophobia. Primary tokophobia is when someone has this fear before ever being pregnant. It could even start when they're really young. And then there's secondary tokophobia, which happens after someone has gone through a really difficult or traumatic birth. And this is a really key point, right? It shows that this fear can come from both the complete unknown and from very real lived trauma. So, a fear this intense, where does it even come from? Well, the causes are super complex and different for everyone, but we can definitely see some common themes. All right, the things that can trigger tokophobia are all over the map. For some, it's connected to a bad experience with doctors or hospitals in the past, so there's this deep-seated mistrust. For others, it's all about the what-ifs, a huge fear of the pain, of something going wrong, or just losing control. And get this, sometimes just hearing scary birth stories from other people is enough to plant that seed of fear. Our brains are kind of wired to latch onto threats, even if they're just stories. And a lot of the time, it can be tangled up with underlying anxiety or depression, which just makes everything feel 10 times bigger. The bottom line, though, is that every single one of these is a valid reason for this fear to take hold. It's a very real condition. Okay, so we've talked about the causes, but what does tokophobia actually look like? What does it feel like? Being able to recognize the signs is so important, whether it's for yourself or for someone you care about. The symptoms really show up in both your head and your body. And we're not just talking about feeling a bit nervous here. This is an anxiety so big that even just the idea of pregnancy can feel completely overwhelming. It can lead people to go to great lengths to avoid getting pregnant, even if a part of them really wants to have a family. And if they do become pregnant, it can be 9 months of just intense distress. We're talking physical symptoms like full-blown panic attacks, heart racing, can't breathe, feeling sick. And look, this isn't just something that happens inside a person's head. Tokophobia has huge real-world impacts. It can put a massive strain on relationships, it can completely control decisions about having kids, and it just takes a huge toll on a person's mental and emotional health. So I know this all sounds really heavy, but here's the most important part. There is help. There's a path forward. This is not something anyone has to deal with on their own. So let's switch gears and talk about the solutions, about how to manage this fear. Tackling tokophobia usually isn't a one-and-done thing. It often takes a few different approaches. The first step is usually just talking to a professional you trust, like a therapist or a doctor. From there, therapy can be a game changer, especially something called cognitive behavioral therapy, or CBT. Basically, it's a type of therapy that helps you catch those negative thoughts that are fueling the fear and learn how to challenge them. Just learning more about the process through childbirth classes can also be really empowering. It takes away some of the mystery. And for some people, medication to help with underlying anxiety can be a really helpful part of the plan, too. At the end of the day, dealing with tokophobia isn't just about making the fear go away. It's really about empowerment. It's about getting to a point where you feel supported and can make your own choices. And that right there is the key. With the right kind of help, from therapists, doctors, friends, family, it is totally possible to work through this fear. The goal is to get to a place where you can make decisions about your own body and your future based on what you want, not based on what a phobia is telling you. All right, let's do a quick recap of the big takeaways. First, tokophobia is a real intense fear. It's not just being nervous. Second, the causes are all over the place, but they are always understandable. Third, this fear can have a massive impact on someone's life. And finally, and this is the most important one, there is real, effective help out there.
So, this leaves us with one last thing to think about. Now that we know all this, what can we do? As friends, as partners, as doctors and nurses, as a society, how can we build a world that's more supportive and understanding for people who are dealing with this? It's a really important question. Thanks for tuning in.